Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today I'm out at the Tempe Town Lake area, which is a gorgeous man-made lake that is used a lot for sailing, crew. There's a lot of events, running and walking paths around here, and it's right next to Arizona State University. So it holds about 1 billion gallons of water, and about a year and a half ago, the end of the lake, which is where these big rubber dam bolsters are, burst. All the water went out of the lake. So it was about 1 billion gallons, and it took them a few months to get the water back, but it's back. It's gorgeous, especially on days like today. The topic for today is the latest research on epidural steroid injections. There's a recent study that came out that was presented at the American Academy of Orthopedic Surgeons looking at epidural steroid injections in professional football players. So there were 47 professional football players who had a herniated disc over about a 7-year period and underwent epidural injections. And they looked back at how well those folks did. They had, I got the numbers wrong. Hi, I'm Dr. David Greene, CEO of Preferred Pain Center here in Phoenix and Scottsdale, Arizona. Today I'm out at the Tempe Town Lake here in Tempe, Arizona, which is a gorgeous man-made lake that holds about 1 billion gallons of water. It's used often for crew, sailing, walking and running paths around it, and it's really gorgeous, especially on days like today, 70 degrees here in March. And so the topic for today is epidural steroid injections and the latest research. So there was a study presented recently at the American Academy of Orthopedic Surgery looking at epidural steroid injections in professional football players. And the study came out with very interesting results. There were approximately 30 professional athletes in the study, and each athlete on average received about 1.2 injections. I think it was about 40 overall. And the study was done over about a 5 to 7 year period, looking at the outcomes. It was very interesting. What they showed is that over a 5-month period after having received epidural steroid injections, 89% of the athletes recovered and were able to go back to high-level athletics, professional football. And that is actually higher than the outcomes on a typical large-scale epidural steroid injection study, which shows about a 75% effectiveness. So this is in line with that, but it's a little bit higher effectiveness, which is good news, especially showing that those athletes could go back to the exact type of activities they were doing before. So the results of surgery were fairly equivalent, 74 to 90% effectiveness after that time period, but surgery is not a risk-free proposition. So additionally, what they showed was that out of the approximately 30 athletes, 10% ended up going on to surgery for a reason of either one, a sequestered disc, meaning that the disc fragment actually tore off from where it came from and sequestered in the spinal canal and pinched on the nerve. So those didn't get better. And the second reason was motor weakness, like a foot drop. So if that occurs, you don't want to wait months and months and months, because even with a technically perfect surgery, it may not get better. So the right thing was done in those cases, and those patients went on to surgery. So anyway, that's some of the latest research, once again showing that epidural steroid injections are very effective for lumbar disc herniations. Our pain doctors at Preferred Pain Center are board certified and fellowship trained, and the best pain management doctors in Arizona. Give us a call at 602-507-6550. Check us out on the web at preferredpaincenter.com. I'm Dr. Greene, Preferred Pain Center. Your pain stops here.